The Global Allergy and Airways Patient Platform believes we can all live better. Today we're going to talk about COPD, which stands for chronic obstructive pulmonary disease. Are you often short of breath? Is it hard to manage your daily life? In just a few minutes, we'll help you learn what you need to know about COPD. We'll look at an overview of COPD, symptoms of COPD, and treatments. Chronic obstructive pulmonary disease, or COPD, is the medical term used to describe a lung condition that causes the airways to narrow and become obstructed, which in turn makes breathing difficult. COPD can be described as a combination of chronic bronchitis, which is a disease of the lungs, and or emphysema, which is a disease of the air sacs. Chronic bronchitis is a result of irritation and inflammation of the bronchial tubes or airways, the tubes responsible for carrying air through the lungs. The tubes swell and produce a buildup of mucus along the lining. Emphysema develops over time, and not everyone with early emphysema has symptoms, but having it can make it difficult to breathe because of the enlarged air sacs. They trap the air in the lung. Air trapping is diagnosed using lung function tests. If you have chronic obstructive pulmonary disease, it gradually becomes harder to breathe. COPD is progressive, meaning the damage to your lungs can't be reversed and may progress. Treatment, medication, and lifestyle adjustments can help you learn to manage it more effectively, control your symptoms, and may slow down the progression of COPD. The main symptoms of COPD include getting easily breathless, a persistent cough with phlegm, frequent chest infections, wheezing, especially in cold weather. The symptoms might occur all the time, or they might get worse at certain times, such as when you have an infection or breathe in secondhand smoke, polluted air, or fumes. These are called exacerbations or flare-ups. It's also possible to experience other symptoms with COPD, especially when the disease becomes more severe or you have other health issues too. COPD develops due to long-term damage to the lungs that causes them to become inflamed or damaged, obstructed, and narrowed. Smoking is the main cause of COPD. However, not all smokers, even heavy smokers, develop COPD, and at least 20 to 30% of people with COPD have never smoked. It's important to know that COPD can be prevented. Whether or not a person develops it in their lifetime is influenced by a complex mix of their environment and genetic makeup. Risk factors for COPD include environmental contributors. This is cigarette smoking or a history of smoking, or work exposure to dust, fumes, or chemicals, air pollution. Genetic risk factors, including a deficiency that is a rare condition which makes people prone to COPD at a younger age. Lung development and aging factors. Chronic infections, for example, HIV is associated with COPD. Social and economic considerations, and frequent childhood chest infections or poor lung development. How is COPD treated? Although there is no cure for COPD, with the right treatment, it can be managed and treated to stop further damage to your lungs, improve your symptoms, and prevent flare-ups. Your clinical team will work closely with you to develop a self-management plan to cover daily living and steps to take if you start to feel worse. There are a variety of treatments available for COPD. Your doctor may prescribe pulmonary rehabilitation, which will provide support on your journey to better health and help you with guidance on best exercise, nutrition, and tools for smoking cessation. Inhaled medicines called bronchodilators, which relax the muscles around the airways, or other inhaled medicines taken through an inhaler or nebulizer. Steroids given via an inhaler to reduce swelling in your airways. In some cases, medications to thin mucus are recommended for people who need help coughing up thick mucus or phlegm. You may get antibiotics or anti-inflammatory pills to reduce the risk of flare-ups. In some situations, you may need surgery that can improve your symptoms. Oxygen therapy can be given using a home unit or small portable tank. In some situations, breathing support through the form of non-invasive ventilation, NIV, or high-flow nasal therapy, HFNT, will be provided. If you think you have COPD, please see your doctor. If you have COPD, be sure it's being treated well. GAP believes in empowering people around the world and wants you to live better. For more information, go to gap.org. The mission of the Global Allergy and Airways Patient Platform is to globally support and empower patients with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of governments, healthcare professionals, and the general public. Thank you for listening. Join us for more GAP Notes health presentations.